logic. What we're going to look at, and the newsletters this week, is focused on hip and hip pain, which can obviously be quite debilitating in terms of ability to get around, walking, sitting, standing. So we want to just go through lateral hip pain, so pain on the outside of the hip you can get, and two common causes, and try and give you a bit of an idea of how to differentiate between the two. So lateral hip pain, if you feel out to the side of your hip, you'll feel that there's a nice bony point there. That is actually this bony point here on the hip. And then as you come up, you get to a second bony point, and that is the outside of the pelvis. So we're looking at the hip down here. So if you're getting pain in that region, which is quite a common thing to get, particularly as we move beyond the age of about 40, we're doing potentially lots of sport, lots of standing, but also maybe if we're starting to change how we're moving, we've got some maybe tightness in our hip joint or tightness in our back, which is loading the hip excessively. So the two problems you can tend to get are a tendinopathy, which is driven by the glute med muscle, and the other one is a bursa. So the bursa will sit just on the top here, and it's like a little, imagine a balloon filled with a jelly substance, and it stops the tendons rubbing on bones or tendons rubbing on tendons. Obviously, if it gets compressed because they're tight, it can become inflamed, and that puts more pressure on it, and it sort of hits a sort of never-ending cycle of irritation. And then the tendons will tend to get loaded if you increase activity suddenly. You do more walking, more running, you can load them, particularly if they're weak, and that tendon gets aggravated by the extra stress that is placed through. So the bursa sits slightly above, the tendon will tend to sit in here, but can also sit all the way through to where it attaches onto the pelvis as well. So your pain will be lateral. What I want to try and do is help you understand which one might be causing the problem, because the treatment will be slightly different. If it's a bursa, we want to rest, we want to ice, we can try anti-inflammatories to try and calm it down, and we'll respond quite well. If it's a tendon, we actually need to keep loading it and go through the process of loading it, because that's how we're going to get it to a better place and get the tendon strong and the muscle strong, so we can cope with that loading again. One of the key things that I tend to find is a really easy way to assess it is to get people standing, small bend, and just slightly flexed, and just standing statically. If that's sore, you're going to be compressing the bursa, and you should feel a real point of pain. That will be the bursa. If you're loading it and the tendon and the pain goes, that's going to be the tendon that's causing the problem, because if you load a tendon without any movement, it tends to be quite happy in that position. It won't cause any pain, and it will feel better. So just simply standing on one leg, what happens to my pain? Does it get worse? Can I feel it? Then it's probably a bursa. Does it go away and clear completely? Then it's probably a tendon. You can accentuate that by going into a knee bend. So if it's not painful and you go down into a bend all the way through, you'll probably feel you're going to load it, and you'll start to feel the pain. So walking downstairs, walking downhill, you'll tend to notice that will start to cause problems as well. Because these two structures are quite close together, sometimes you get a little bit of both, and then it's working out which area you want to prioritise. So I would always go for the bursa, because you want to calm that down first, then you can deal with the tendon that's out of the way, because you want to load and increase load as you're going through. Okay, so a little bit of information on lateral hip pain. Hopefully that's helpful. Hopefully it can get you thinking about what you need to do. Obviously the main thing is, if you do have a problem, try and find somebody to come and help you understand exactly what your problem is, and make sure that you get the right pathway to clearing your pain up and getting back to the activities you want to do. Okay, thank you.